I was born and raised in China, and in China we don't have geriatrics, and I feel like there are not a lot of attention paid on the elderly folks. I am a family member of a patient, and I'm not very happy with the care my parents received, so I want to become that kind of doctor that can provide better help, better provider, better medical service to the patients, just like my own parents. And that's kind of the reason why I want to become a doctor. I function as a consultant, meaning my patients still have their primary care and they need additional help. For example, in memory care, polypharmacy, geriatric problems. My initial visit is about an hour long, and I will do something called a geriatric assessment, including a full geriatric evaluation, including their home situation, their social environment, their medical concerns, do a memory evaluation, and their function status, mobility, medications. And I think my goal, especially for geriatrician, is to find what matters most to my patient. I want to help them to achieve their goals. The best thing is to know them, treat them. I think one sentence my old professor told me is, treat the patient in front of you as a person, but not as a medical condition or a number. I think that's the best way to connect my patient is to know them. I actually do virtual visit both through, if they have clinical patient, they do have my chart, and I also do telephone evaluations. And sometimes in, situations that the patient, really live in rural area and they don't have transportation. Sometimes what I can do is something called e-consult to see my patient back and says, "Doctor, I'm really glad you're here." It's just, appreciation from the patients and know that something I do can help other people and can help them to have a better life and a good quality of life. I think that's the most rewarding part.